Well, hello and welcome. You're watching NewsX. I'm Megha Sharma and we're talking about the yellow alert that is likely to be sounded by the Delhi government and the Delhi Disaster Management Authority in a few hours to go from here, keeping in mind that the positivity rate has reached at an alarming 0.68%. Now, the criteria for providing a yellow alert, which is the lowest alert as per the graded action plan that has been put forth by the Delhi government in wake of the lessons it had learned during the second wave and has also been implemented in the rest of the country as well, is under the discretion of the state governments respectively. Under the yellow alert, if the positivity rate continues to be at 1% for 2 consecutive days, or the cumulated positivity numbers cases are 1500 for two consecutive days, or if the oxygen beds in the state are at one point of time reaching a rate of about 1500, then it is that we put out the yellow alert. Let's actually discuss this, deep dive into this entire system of the graded response action plan that has been set out by the Delhi government and how effective it is going to be in being able to curtail the number of cases that Delhi is going to witness in wake of a possible third surge. Let me actually bring in to you the salient features of what all includes if a yellow alert is sounded off. And if my team can actually put out the text that I had given on the teleprompter, it would be of much help to me. All right. As per the yellow alert, like I said, if the cumulative positive cases in a duration of 1 week end up touching 1500, or the positivity rate continues to be at 0.5% or more for 2 consecutive days, or the oxygen beds in the hospitals of the state are at 500 for an entire week, is when we sound the yellow alert. Cinemas, banquet halls, auditoriums, spas, gyms, entertainment parks, yoga centers, they all are going to be shut. There is going to be a complete ban on social, entertainment, religion, political, festival-related gatherings. Sports complexes, stadiums, barring the national and the international sport events, and entertainment parks will also be shut. The shops and the markets and malls dealing with non-essential goods and services will be allowed to open as per the odd-even formula from 10 a.m. to 8 p.m. The weekly markets will be allowed as per the municipal zone at half the vendor capacity. Restaurants can operate at 50% capacity. Bars from 12 to 10 p.m. also at 50% capacity. Delhi metros and buses will be allowed to operate at 50% capacity. And those that are actually allowed under the yellow alert are public parks, gardens, construction activities, industrial establishments, e-commerce, barber shops, salons, as well as beauty parlors. All right. So that's the case for yellow alert. And amber alert, we have the red alert, and before that we have the orange alert. Red alert being the worst of the alerts, it's total emergency. The total positivity rate breaches 5 for 2 days in a row. City records 16,000 new cases per week, and the average occupancy of the oxygen beds in hospital remains at 3,000 or above in one particular week. Let's open up this discussion. Let me rope in my panelists for the day. That's Dr. Mohsin Wali on the broadcast with me. Dr. Mohsin Wali, we are extremely close to actually sounding the yellow alert in the state. We already have a positivity rate of 0.68%, and this has steadily increased in the last 48 hours.
Yes, thank you. Am I audible to you?
Yes, sir.
Yeah, you all have become great scientists. I must compliment your work, homework, and with the great knowledge you come and sit with the panelists is wonderful. And my stress on these things would be that the data which we have are very alarming. We are lucky as compared to the Western countries. The increase in cases and the total number of cases, occupancy of the hospital beds, demand for oxygen in the patients is all very dismal. but the travel-induced rise and new detection of Omicron cases is alarming. And every time we are discussing, could be from one state, there is a fresh case being reported. So this situation, you are right, we are nearly at yellow alert level 1. As you said rightly, there are 4 levels: level 1, level 2, which is amber alert, then there is an orange alert, then there is a red alert. Thankfully, nature is helping India. India has acquired good immunity due to the Delta wave, and our even children population, our adult population is showing restraint from getting new cases of Omicron and Delta virus. Our total numbers are increasing slowly, gradually they are increasing, which is a bit worrying for me, because the detection of the Omicron is like the tip of the iceberg. And if on this data we base on our alert level, this would be a little lower. You try to understand what I mean. Because we are not testing each and every case of Delta virus or each and every case of coronavirus we are
You're
having.
right.
We are
Yes.
detecting like a tip of iceberg, less cases. Despite we have a kit which can detect this faster, and the kit has been approved by ICMR and also our laboratory authority. So we should smartly test more and more cases for genomic sequencing. We should increase the capacity of our existing genomic labs. We cannot erect genomic labs over time. It's a costly proposition. And what you said in your description, we have already crossed 0.5 level for 2 consecutive days, and therefore we have already covered the yellow alert.
Yeah.
Now, my worry, and everybody's worry, your worry, people are not listening. The videos which are coming from the malls, videos which are coming from the market, what does it mean? People are not listening. The conferences, the weddings, the functions, people are gathering. People are preparing for New Year. Who will patrol? Who would police them? This is main worry. People should realize that how we can help to prevent this pandemic, how we can help to reduce the spread of coronavirus. Unless that happens, no law of the land can stop people in India. You see, India is a very a country which has a very diverted or variegated appearance, and you cannot control the crowds in the metropolitan cities. It is very difficult unless people themselves decide. I am giving you example. Day before yesterday, a very senior person sent me the video of the exit gate of the mall, which is a very famous mall, Select City Walk. People were coming out like we have seen at Sialda Junction. It's like when the trains come, the Sialda throws a crowd. Same way the people are coming and going in. This is only when the eateries are being crowded and the shops in the mall, they are not being crowded. People are not going to buy stuff there. People are just going to sit, gossip, eat, and come back. This kind of attitude is very, very pathetic. This kind of attitude is very dangerous for the next 2-3 weeks. And this kind of attitude would be responsible despite any alert you put. You may say tomorrow, it's not yellow, it is amber, it is orange. Why? Because people are not cooperating. Despite appeals from the Prime Minister, despite appeals from Mr. Chief Minister of Delhi, despite appeals from our other authorities, people are not listening. So my basic stress is people should realize through all your efforts, which you are putting efforts to educate people, to impress upon them that look here, there is a contingency, deal with it, get yourself vaccinated, get yourself boosters now from the 3rd and from the 1 week after the 3rd.
You're right. You're right. But then the question arises, and I like to pose this question to Dr. B.S. Vivek. Now, this alert system was not present during the second wave. It had been formulated by the Delhi government and also replicated in other parts of the country of having this automated response action plan in hope that once the alerts are sounded, whether it's the yellow alert or the amber or the orange or finally the red alert, there would be then a voluntary reaction by the public, by the residents of Delhi, who would react to it accordingly and take steps in their own right and means to allow for the propagation of the virus to stop or at least get mitigated. But if we do not see that on the ground without any fines being imposed or without any compulsory lockdowns or curfews being imposed, it comes across as a futile exercise in putting out these alerts.
Yeah, you're right. Actually, this graded action plan is not a new thing. This was at the behest of the Supreme Court. It was established way back in 2016. And that time, basically, the Delhi Disaster Management Authority was given in charge of formulating this. And so this does not exist solely for COVID. Basically, it's for any disaster. And what more disastrous thing like this small invisible virus, which has put the world on its knees. So this graded action plan is an administrative step which has been taken long back for other reasons, but its implementation is for the first time being so forcibly visualized and carried out. So you're right. The profound insanity of our population, as a society, we just, as Dr. Wali was saying, we just refuse to see that the guillotine is in our heads. We don't have the basic sanity to realize the principles which has led to the disaster that we all saw and faced in the month of April and May in 2021. And similar thing is approaching. And I mean, all and everyone is saying the same thing, but when it comes to going out to malls and other places, as Dr. Wali said, you have to see it to believe it, the madness that is going on. Now, this graded action plan has to be forcibly implemented now. It is not only the public, because the public fails to take the initiatives. So the government has to, put a stick to the whole affair and make people forcibly go through certain basic steps that we all, as responsible citizens, should have taken anyway. So the list of activities that you have, in detail read out and you're showing and making people aware, basically has existed for quite some time to come. Unlike, say, UK, where it is being a combined effort of the citizens as well as the administration, because the UK has gone into the red zone already, and we as a nation are fortunate to be spared these couple of months wherein the Western population undergoes a particular wave, and then we get a good 2 to 3 months for the same wave to travel. And that is wherein, as a society, we should respond in a more responsible way and know that we are not going to escape it. And we have seen it umpteen number of times. Now it's the third time. And if still we refuse to take the necessary steps, we are actually unfortunate, I would say, as a society, that we do not see the bull charging at us. So let's,
okay. All right. So then right. Dr. Vivek Gupta, you've heard it from my other panelists, the good doctors, mentioning over here that there needs to be desistance from the side of people of the state to not step out, to not take flights, to not make travel plans domestically. It's impossible to do it internationally, but even curtail themselves from making plans to travel from one city to another. Or, this is the festive season, do not step out and gather in large numbers. Do not call in people at your home if parties are not allowed outside. But what is it going to take for people to sit up and listen? We had been playing visuals, and if we can play them again, of the markets, Sarojini Nagar Market, Lajpat Nagar Market, Sadar Bazaar, they are all chock-a-block with people. These malls, be it the Select City Mall or we're talking about the DLF Mall, they are all full of people. The positivity rate is 0.68%. Do you think it's because of the lack of awareness, or people are in denial mode? They are hoping and praying that the virus does not hit them, and if it does hit them, it takes a few more days. They're just lingering on, they're just trying to push it back, because they understand that back in the day, during the second wave, the kind of hardships they had to face.
It's a very valid point. I will little differ from what the government is thinking. You see, this is a viral disease. This is not the enemy where you can see on the army on the other side of the border, you can see and you can start firing at the. This is a virus which is lurking, Lurking, which is hidden. And we have suffered a lot during the first as well as mostly in the second wave. I would say the graded action plan is okay because you see have to weigh the economy as well as this, where they have said positivity rate of this and this, number of beds occupied this and this, number of new patients coming this and this, then you have to add yellow, amber. But I personally think we have to be a little more cautious and we should be going an extra mile. We should go an extra mile to curb this virus. We just criticizing and blaming the citizen of India, where mostly youngsters at the age of 20, 25, 30, 35, 40 would like to enjoy this time. It's impossible to curb them unless you have an actually graded plan. I would say this is a time the positivity rate of 0.5, you are only yellow, where you're opening the malls 50%, metros 50%. How can you decide this 50%? When you're allowed to go, you're allowed to go. What I mean to say, the citizens are very naive. They are simple people like us. In fact, I am coming to Apollo Hospital. Many times I don't take the mask. But of course, most of the time I'm with the mask. What I would like to do, the government to do, if we have to be, we are twice bitten, thrice shy. We know once bitten, twice shy. We are twice bitten, thrice shy. This is a time where we should put a more extensive and more elaborative and more stricter rules, so that the people are not allowed to go out at all for at least for 1 month. Only 1 month is enough, because if you can curtail the virus, this virus is hidden. If you see, we keep on waiting for the positivity rate to come down to 2, or keep on waiting for number to increase further, and then putting this, already the battle is lost. This is what happened actually during the wave 2 also. So what I want to say, I'm not totally satisfied with the grading system which we have done. We cannot keep on waiting. This is a hidden virus, a lurking virus. It's a dangerous virus. It can be dangerous. We don't know.
Okay.
You see, I will give you an example. The France yesterday had about 1 lakh patients and 16,000 patients were hospitalized. In India, we don't have major hospitalization. Maybe it's because of the vaccine, because of our own innate immunity, because we have been natural immunity, because a lot of patients have already been suffered. But we cannot take it lightly.
You're absolutely right. We can't take it lightly. So, Dr. Mohsin Wali, does this graded system actually work? Do we continue to wait for the positivity rate to reach 2%, then 20%, and then put for the red alert? Or should precautionary, preemptive measures already be taken by the government? And is shutdown the answer to it? Can we save the lives and the livelihoods and still fight against the virus?
All is being done to stress the system, health system. People are not careful. I would agree with Dr. Vivek Gupta. These plans are made in the offices, on the files. But when it comes to implementation, see, day before yesterday, they have fined people for not wearing masks around 1.75 crores. Even then, you don't see masks on the road. That's the problem. People are now giving money. Okay, let us enjoy, pay fines. This attitude is very bad, very sickening, very dangerous. Yeah. I would say, if this program, people get only one message, to wear mask, that would be 75%. Next 20% is COVID appropriate behavior, and next 5% is go for vaccination if your vaccination is not complete, and then they are saved 100%. If they are disciplined for mask, it's the major preventive measure, and this is very important. The mask saves us, proper mask with worn properly, like N95 mask, worn properly, airtight, of good size. Now, another problem has started. Good companies are starting making masks in different sizes. And people are using undersized masks. This is useless. So, all these plans are made by wise people. They are to be implemented. Whenever we do grading for something, as Dr. Vivek was saying, this is a standard procedure to gauge the severity of the problem. Unless we have a grading system and put this in a table, what's happening outside, we cannot know what's happening outside, because everybody doubts. When you talk of death rate, people doubt. When you talk of admission rate, they say they have no correct data, data is fudged, everything gets fudged. So the responsibility lies, again I'll come to my point, majority of responsibility lies on us.
Yeah.
We should be.
But then how much can the government of Delhi rely on the people to be responsible is the big question. Dr. B.S. Vivek, are the people at this point of time on the back foot, enjoying themselves in denial mode because they are waiting for the government of Delhi and the government of India to take stringent action, put compulsory lockdowns, and they have shrugged every single responsibility that they've had. They said, you know, we're waiting for the yellow alert to become amber, amber to become orange, and then once the red alert happens, the government is anyway going to put a lockdown. So let us enjoy the few little days that we have left with.
No, I won't put it that bluntly. We are, after all, at least as when you talk of Delhi and NCR, at least the middle class is quite educated and aware, and especially people who are not even literally aware of things. They have actually faced two pandemic spikes, and more often than not, we see that it's not just the will to start enjoying and freaking out in all sense. It's also, as Dr. Vivek Gupta was saying, that people usually tend to look over their shoulders and actually believe somehow that this virus or this particular disaster is going to go, they are going to be untouched and it's going to affect others around them, maybe not them. But that small little feeling of false, safety, that has to be curbed. And that is where we require this strict administrative action. The two spikes that our country has seen, our country had responded in two dramatically opposite ways. The first was that initially we were into that complete shutdown, as Dr. Vivek Gupta was mentioning. And then we also realized that it had its implications. There were economic, psychological implications of a complete shutdown. Mm-hmm. So this concept of graded response action plan is there worldwide. It is a WHO recommended thing. It's not what a Delhi government has come up with. And more or less, there are certain, this has to be decided by the society in its fineness. But more or less, there are similar sort of activities that are curbed, say even in UK, where, as I said, it's a red alert going on there. And in fact, we are following suit now. The second spike that we saw actually was a place where we were more into the decisions were taken more according to the whims and fancies of the administrators. There were no guidelines, and guidelines do help us to follow some path in this uncertain situation where the world has not seen this sort of a disastrous situation earlier. So the guidelines do help us in a way, and the public is therefore guided, and we do require administrative strictness. But that is how we work as a society, unfortunately. That is how our nation, most of it works. We need a stick to put us through into the right system.
Okay, so the impetus needs to be there. Compulsory actions need to be put down. Lockdowns need to be put down. Fines need to be adhered to for the people of our country, the people of Delhi, to follow the rules, fall in line. Dr. Vivek Gupta, at this point of time, as much as the government of India, as much as the Prime Minister, as much as the state and district authorities harp upon the point that they have enough medical infrastructure, healthcare centers, oxygen beds, oxygen plants ready in case of any eventuality, what are the actual figures on the ground?
See, I would really congratulate the Honorable Prime Minister and also Ministry of Health and Family Welfare. Under their guidelines, most of the state government have got enough capacity to see, because you see the government of Delhi, if you're living in Delhi NCR, they also have a temporary hospitalization methods also available. If you remember, before actually the COVID started, I'm talking of early 2020, we had only, I was doing a webinar with Italy and France, and we discussed on how much ventilator beds. At that time, we had only 1 lakh ventilator beds all over India. So now the capacity has been improved to more than 5 times, just because we have suffered during wave 1 and wave 2. I think as far as capacity of the government is concerned to actually house the patients, if at all such an emergency arrives, we are fully equipped. And I would say, and I was talking to another minister here without naming him, that the capacity for the people in India, especially in the Delhi NCR and most of the states of India is now, I would say, for myself, I would say it's quite satisfactory. But at the same time, we cannot gauge how much, because we see, if you remember, January, February 2021 and March, when the Delta was discovered, and April, after the rallies of many elections which happened, there was immediate surge of the infection, and that was Delta wave, Delta virus. Now Omicron is 4 times more contagious, although it is less virulent. That means capacity to cause oxygen or pneumonia, oxygen requirement to pneumonia. But you never know how much surge happens after 2 days, because IIT, again, the professors from IIT are still feeling that the number of increased by February, and Niti Aayog has gone extra mile to say that it can be 14, 15 lakhs a day. If it is like this, if the hospitalization rate is only 1 to 4%, then of course there is a possibility of overwhelming on the hospitalization beds as well as the healthcare system. That is why I say it is better to take a more strict actions, or not actions, but strict measures to not to have the problems as we say faced in the wave 2, because at least Omicron is highly and much more infectious as compared to Delta, if not virulent. Even if the number of cases of 14 or 10 lakhs per day happens, then at least if the requirement of hospitalization even less, then also there is a possibility that we may be having an overwhelmed healthcare system. So I would come back to my point that the citizens cannot be blamed at all, because out of 3 points of COVID appropriate behavior, one is social distancing. I would say it is more of a word which can be used, it cannot be practiced. It is not, I will not say a farce, but it's something which is not practical. Second is sanitization. You can do it for some time, but you cannot keep on doing every 2 minutes, because when you go out, you can touch anything. You can touching the car, your door of the car, and you walk inside and you go to the market. Again, this is not going to work. The only thing which I completely agree with Dr. Wali is the mask. So if we at least educate and tell, there should be hoardings and there should be some loudspeaker in the malls. Please wear our mask, please wear our mask, and every 10 minutes, half an hour, if there's some, especially in the malls and wherever you are allowed inside the metro, then this is going to help. The only thing which can help is the mask and properly worn mask.
Right. But again, the question, yeah, you're absolutely right, sir. And I'll have to take a quick short break. But after we come back from the break, we discuss about the vaccination that needs to be provided to the children, and the question with regards to the virulent virus that is Omicron. Is it milder than the Delta variant, or is it because of the vaccination that people have already had that the impact